Here we are again. This is Dr. Jenkins, our last video for the week 4 lab. And this is all about the respiratory system. I know that you've got a great foundation from lecture with Dr. Kelly. That's fantastic. What I want to do is I want to just go over a couple key things on the anatomy and then just review the breathing mechanics. These are the things that you will need to be reviewing to prepare for your lab quiz this week. Okay, I'm not going to go through all the anatomy one by one because, like I've said before, a lot of the anatomy is just you looking at the pictures and memorizing it. But there's a couple tips that I like to try and give to help out. So here we go. These are the same pictures that are the ones that are on Blackboard for you to review. In this particular case, in this picture, this is showing you the regions of the pharynx. The pharynx is another word for throat, but because we are taking a college-level anatomy class, we do not say throat, ladies and gentlemen. We say pharynx. Within the pharynx, which extends all the way down here, there are 3 regions. The most superior or highest region is the nasopharynx, named so because it's by the nose. The middle region is the oropharynx because it is at the same level as the mouth. And the most inferior or lowest region is the laryngopharynx because it's closest to the larynx. So the whole thing is the pharynx, otherwise known as throat, but we're going to say pharynx. And make sure you review the 3 regions. You can review the nasal cavity. The epiglottis, as I'm sure Dr. Kelly has pointed out, is a flap of cartilage. Let me get my marker here. Let's go with the dark blue. Okay. So the epiglottis is this flap of cartilage right here. That's the epiglottis, flap of hyaline cartilage. When you bring in food, you have a yummy piece of food, and then you go to swallow, we want the food to go down the correct tube. And of course, the food is going to go down the esophagus. We don't want the food to go more anterior and into the trachea. So when we swallow that food, when we swallow, the epiglottis comes down. So instead of being at its resting position, the epiglottis, hold on. Let me just make sure I get this right here. When we swallow, the epiglottis comes down and it covers the trachea. So that way, when we swallow, food can only go into the esophagus. It blocks off the trachea. For lab, I'm just worried about the anatomy, so you'll just need to know that that blue fat flap of cartilage is the epiglottis. You can see the larynx or voice box, and we can see the thyroid cartilage, which protects the voice box. This is a view of the larynx. This view up here is kind of a side view or a sagittal view. But what if we shoved an endoscope? And this is what doctors do. They shove a little scope down the mouth or the nose, and it's got a camera. And this is what your vocal cords, which is where your larynx is, would look like. You only have to know the glottis. The glottis is the opening, which I'm trying to show you here, right? The opening in here is the glottis. And what happens is, when we talk, we push air through this opening, and it vibrates these side pieces of tissue, and the vibration of those vocal cords, or the side pieces of tissue, is what creates sound. However, for this class, you only need to know, if you see this view of the larynx, for the lab I mean, what you need to know for the lab. If you see this view of the larynx, just know it's the larynx, and just know the space, the opening shown in blue, is the glottis. You can see the trachea, of course, is the windpipe, but you're going to say trachea because now you know that to be true. And I want to point out The branches coming off of the trachea are called bronchi. The original branches are the primary bronchi. The primary bronchi branch into the secondary bronchi. And the secondary bronchi branch into the smallest branches here, contained within the lungs, the tertiary bronchi. When we look microscopically, the tertiary bronchi, what color should I use here? Let's do black. The tertiary bronchi will branch, so the tertiary bronchi are here, right? The tertiary bronchi will branch even more into the bronchioles. Notice the difference in terminology. All of the ones we've covered previously, primary bronchi, secondary bronchi, tertiary bronchi, they eventually branch into smaller microscopic airways called bronchioles. And the suffix -eoles tells us that it's smaller. So we can't see the bronchioles in this picture because they're microscopic, but the next picture I have here shows you the bronchioles, which are these gray things. And of course, the bronchioles branch into the air sacs or the alveoli. Everything else on here, you don't need to know. You only need to know that the bronchioles branch into the grape-like structures called the alveoli, which is where gas exchange happens. And as I pointed out, the bronchioles are extensions off of the tertiary bronchi. Look at all the learning we're doing, folks. Okay, this picture here, it's a pretty simplistic picture. I dare say even I could maybe draw that well, although I shouldn't say that because in the past, in class, when we've been in class, when I draw a lung on the board, some people have said it looks like a testicle, so I really shouldn't. People in glass houses shouldn't throw stones. Anyway, there are some coverings to the lungs. And in this picture, I like it because it's simple. And we can see that there's two coverings of the lungs. An outer covering I'm showing you in green, and an inner covering, oh, let's choose pink, right? And between those two coverings is a space. Well, make sure you know the name of these two coverings. The outermost covering of the lung is called the parietal pleura. It's shown in green on the right side of your screen. It's shown in blue on the right side of your screen and green on the left. But it's the outer covering, parietal pleura, because parietal means outer. And then the inner covering of your lungs is called the visceral pleura, because visceral means inner. Okay, now here's where I want to get into the fun stuff. I want to review the mechanics of breathing and the volume pressure relationship that is happening during inhalation when you breathe in and during exhalation when you breathe out. At the end, I have put a nice table reminding you of the volumes and pressures that I'd like you to know for your lab quiz. But let me go through it because I think it's really worth going through. All right, let's do, in red, we will do inhalation. So let's talk about when we inhale or breathe in. Inhalation. When we breathe in, you know what happens, even if you do it right now. If I ask you to breathe in order to breathe in, you're going to increase your lung volume. Take a deep breath. Your chest is going to increase. So if I'm talking about the intrapulmonary is referring to inside the lungs. So when I breathe in, I contract my diaphragm and my external intercostals. When I breathe in, I contract muscles to increase my chest size. And really, what I want to do is I want to talk about, because what increasing your chest size means is we're increasing the intrapulmonary volume. Now you see, when this volume goes up, there is an inverse relationship between volume and pressure. So when volume is high, pressure is low. So because I increase the chest size, which increases the volume, and I can see I made a mistake here. I put a P here and I meant to say, let's go back here. Okay, my bad. This should say an increase in volume. Okay, so when I increase the pulmonary volume, when volume goes up, the pressure goes down. It's just a rule of physics. So when I increase the intrapulmonary volume, the pressure between the gas particles goes down. So I decrease the intrapulmonary pressure. Okay, when we talk about bringing air into or out of our lungs, that air moves along a pressure gradient. So we're going to be comparing, we're always going to be comparing the intrapulmonary space to the atmospheric. So out in the air, we have the atmosphere, right? And it's pretty simple for us to measure the atmospheric pressure. Maybe you know this. The atmospheric pressure at sea level is 760 millimeters of mercury. The higher you go up in elevation, the atmospheric pressure goes down. Here in the Albany area, if that's where you are, we may be anywhere between 100 and 300 to 400 feet above sea level. So we're not that far from 760 millimeters of mercury. If I want to know how is air going to move, I simply compare the pressures. I look at the atmospheric pressure and I compare it to the intrapulmonary pressure. Now, when we inhale, because our chest size and our intrapulmonary volume goes up, the intrapulmonary pressure goes down. Let me assign a number just to help us understand this. Let's say that our intrapulmonary pressure is 755 millimeters of mercury. Now I can see the direction that air is going to move. I compare the atmospheric pressure to the intrapulmonary pressure. Air is going to move from high to low pressure. So in this case, air is going to move from higher pressure in the atmosphere to lower pressure in the lungs. 760 is higher than 755. This is exactly the principle behind how we bring air into the body. We contract respiratory muscles that increase the chest size. And when we increase the chest size, the intrapulmonary volume goes up, but the intrapulmonary pressure goes down. And anytime the intrapulmonary pressure is lower than the atmospheric pressure, air is going to move from higher atmospheric pressure down into the lungs where it's lower intrapulmonary pressure. Feel free to watch this over and over again. I know it's simple, but if it's the first time that you've learned this, it can be a lot, but it's nothing that you cannot learn. I'm here to help you. Now let's compare that to exhalation. So now, instead of inhaling, let's talk about what happens when we exhale. Again, we're going to be comparing the intrapulmonary and the atmospheric pressures. But think about it. When you exhale, take a deep breath in and then push out. What is happening to your lung volume? When we exhale, our lung volume gets smaller. This is the opposite of when we inhaled. So now our lung volume gets smaller. So I'm going to contract certain muscles and relax others to decrease my intrapulmonary volume. Go ahead and breathe out. Your chest size, your chest cavity, your lung volume gets smaller. So we have a low intrapulmonary volume. But we know that when volume is low, pressure is high because volume and pressure are inversely related. So now, when intrapulmonary volume is low, that means that intrapulmonary pressure is high. Now we're going to again compare this to the atmospheric pressure. The atmospheric pressure is going to stay steady unless you change altitude. That should be an I, atmospheric pressure. But let's use the same atmospheric pressure we used in the last example at sea level, which is 760 millimeters of mercury. Now, the intrapulmonary pressure, let's say, is high. Let's say it's 765 millimeters of mercury. So again, to determine how air is going to move, I'm going to compare the pressures. I'm going to compare the intrapulmonary pressure, which is the pressure inside the lungs, to the atmospheric pressure. Inside the lungs, it is 765, and outside, it's lower, 760. So now, during exhalation, the air is going to move out because the air moves from higher pressure inside the lungs to lower pressure in the atmosphere. So when we exhale, we contract and relax certain muscles of our chest to increase intrapulmonary volume, to decrease intrapulmonary volume. And when I decrease intrapulmonary volume, the intrapulmonary pressure goes up. And when the intrapulmonary pressure rises above the atmospheric pressure, air is going to move from high inside the lungs to low outside, and air gets blown out. I have a nice summary table. You don't need to know the muscles, okay? So I just put them here FYI, but you do not need to know them for the lab quiz. However, I would like you to know the intrapulmonary volume and pressure, and then how that relates to the atmospheric pressure. And how did we determine the direction that air was going to flow? By comparing the intrapulmonary and atmospheric pressure. Air is always going to move from high to low. So when we inhale, air moves from higher pressure in the atmosphere to lower pressure inside the lungs. Versus when we exhale, air is going to move from higher pressure inside the lungs to lower pressure in the atmosphere. Spend some time with this. Ask me questions. Have them. Once you get it, it's going to feel like, I get it. All right. Any questions, let me know. Good luck, everyone.